Tuberculosis, or TB, is an infectious yet very treatable disease. Only the length of recovery is the hard or agonizing part, at least 6 months of isolation and sustained medication. A treatment adopted and recommended by the WHO is said to cut recovery time by a third, from 6 to 4 months, that Rod Lagusa dwells on in this story.
Shorter time for treatment and implementing active case finding are some of the measures of the Department of Health to strengthen its campaign against tuberculosis. Health Secretary Ted Herbosa said the department will start the implementation of shorter medication treatment period for tuberculosis patients.
To adopt the 4 months treatment for regimen, which is a 2 months list of drugs, and then another 2 months of a different set of drugs. This is for the regular drug-susceptible tuberculosis. And then meron tayong 6-month regimen naman for the drug-resistant tuberculosis.
According to Dr. Keziah Lorraine Rosario, the Action Officer for Presidential Directives on Tuberculosis, the country's treatment success rate is at 79%, which is lower than the global standard for drug-susceptible tuberculosis at 90%. The department hopes that with much shorter treatment time, patients will be motivated to complete their respective treatments. Secretary Herbosa also emphasized there are various social determinants or determining factors that affect patients and keep them from taking and completing their medication.
Which is informal settlers living in one small space that they get to reinfect each other. People hiding it because of the stigma of the fact na may TB yan, di ba? Tapos ayaw nila pumunta sa TB dots kasi na-identify sila. So itong social determinants and changes in behavior we will also address.
Part of the efforts of the department to address the issue of tuberculosis is implementing active case finding, which is considered game-changing.
It is very important to increase the efficiency of active case finding in target population, and this would include also intensified and active and passive case finding in health facilities and systematic screening for health workers.
Also, part of its implementation is the use of innovative technology and coordination with the private sector, which will greatly bolster the campaign. The department will also address the issue of logistics and supply chain management to ensure there is enough medicine for tuberculosis patients in TB dot centers. The DOH will closely monitor the implementation of its tuberculosis program up to the grassroots level. And at the same time, the department urged local government units to prioritize the implementation of the tuberculosis program in their respective jurisdictions. Rod Lagusa for the Nation.